So you have a patient with head injury. How are you going to evaluate this patient? So number one, you will have to take a full history of the patient. You will have to understand if this trauma was rapid or if this was gradual. Number two, you have to take the history of alcoholism, because alcohol can not only mimic the symptoms but it can mask the symptoms as well. Third, we are going to do a neurological examination where we will check the temperature of the patient, the pulse, the blood pressure, the level of consciousness. We will check according with the Glasgow Coma scale. We will check for limb movements, if there is weakness or if there is extension or flexion or something like that. Apart from that, we will check for other traumas also, if there is abdominal trauma. In sometimes in case of RTS, we also have fractures and stuff. And then if there is bleeding, if there is skull fracture, if there is avulsion, if the patient has low BP, headache, bradycardia and all that stuff, then we will have to admit the patient to the hospital right away.